great to see you. Thank you for coming out. My name is Justin Lang, and I work as a facilitator on this project that is titled Reimagine Public Safety in Pittsburgh and Allegheny County, which not only reimagines public safety, but also reframes and how even we think about the past of this whole area, quote unquote, of public safety. We're going to have, first, you're going to hear from Brandy of APA and Jasiri of One Hood. APA, Alliance for Police Accountability, and One Hood were the conveners of this project. And then we're going to hear from people who represent different aspects of this report. You'll see it was a very broad collaborative effort, and you'll be able to hear from different people who spoke and worked on different elements of the project, and then we'll answer questions at the end. And so I'll kick it off now to Brandy and Jasiri.
Good morning, and thank you for being here. I am Brandy Fisher, founder and CEO of the Alliance for Police Accountability, and this morning we are here to talk about the work that we have done for the past 3 to 4 months on this vision. On January 20th of this year, a man by the name of Patrick Warren was murdered by KPD Police, Killeen Police Department, as a result of a mental health call. A call for mental health distress should not end in someone losing their life. And that is one of the primary reasons that we are seeking alternatives to policing. When we have public health crises, police are not the proper people to respond to those. We have professionals, public professionals, health professionals to do so. Today, I also would like to thank the sponsors of our coalition, the Pittsburgh Foundation and Staunton Forum Foundation. We appreciate their help and their services. And next, I wanted to introduce Jasiri X from One Hood to go into the process that we went through and to enlighten you on how we got to this place. Thank you.
Peace. Let me get this mic up a little bit. I'm Jasiri X. I'm the co-founder and CEO of One Hood. I just want to first take some time to thank our coalition members. This was a truly, community-led vision and community project. This is one of the reasons, instead of a report, we're calling it a community vision. And one of the reasons we wanted to come together because we felt like, although there were other processes that were put together, that we wanted one that was community-led. So I want to thank Aaron Arnold for Prevention Point Pittsburgh, Alice Bell from Prevention Point Pittsburgh, Ashley Commons from the Alliance for Police Accountability, Saudia Durant from the Abolitionist Law Center, Bonnie Fan from the Coalition Against Predictive Policing, Leon Ford Jr., Robert Salim Holbrook from Abolitionist Law Center, Miracle Jones from One Hood, Michelle Kinney from the Antoine Rose II Foundation, Robert Lawrence from East End Therapists, Fawn Walker Montgomery from Take Action Mount Valley, Dolly from Abolitionist Law Center, Jesse Wozniak from Alliance for Police Accountability, and Elise Pinchback Johnson, who was our project manager, who made sure that we were on point, and she really did a great job. And Justin Lang, who is here, he's our facilitator, so we said you might as well facilitate the press conference as well. But our process really began in October of 2020. Myself and Brandy kind of coming together and saying, we wanted to convene this community-led and driven process. We had 5 community meetings where these were these 3-hour visioning sessions. We had 2 public meetings. One of the public meetings, we actually had national partners come in from organizations like Cahoots, the Center for Policing, and so. But I think most importantly about our process is we also wanted to make sure that we were centering actual victims of police violence. This is why we felt like it was important to have Leon Ford Jr. on our steering committee. We felt it was important to have Michelle Kinney, the mother of Antoine Rose II, on our steering committee, because this was one of the things we also saw that was missing in some of these other processes. People that were directly impacted by police violence And secondly, people that were actually involved in the protests. I thought it was very interesting that, it was the protests. It was the young people who came together and got in the streets and organized protests was the reason that we were having these different policing coalitions. But at the same time, those individuals or those groups that were involved in organizing and leading the protests were not invited to the table in these other different task force and coalitions around policing. So we also wanted to make sure that we had a space for the very reason that we were here, because folks were organizing and protesting around policing. We also wanted to thank Alliance for Police Accountability for their report, Apartheid Policing in Pittsburgh, Why Defunding the Police Can't Wait. We also want to thank the Policing in Allegheny County Collective for their report, Alternatives to Police, a resource guide for implementing alternative public safety programs. And so, I'm going to bring it back to Justin, but we're going to hear from different members of the coalition. We focused on 4 major areas, which was violence, drug use, homelessness, and mental health. And so we had folks in those different areas kind of break out and begin to think about overall vision of policing, but also that vision. And the last thing I wanted to say is was also what was powerful for me about this process is I personally learned a lot, particularly about the data that we use. This was community-led, but it was also driven by the data that shows what police do and how police do their job on a daily basis. And I think that's very important for us to get to a point where Pittsburgh actually becomes a safe place for Black people. As it currently is right now, Pittsburgh is not safe for Black people, and the police play a role in that when we're 6 times more likely to be pulled over by police, harassed by police, and brutalized by police. We have to say that police play a role in making us as Black people unsafe in the city of Pittsburgh. This is why we want to reimagine it.
So next we're going to hear from Jesse Wozniak, professor of criminology from WVU. Jesse was the lead writer on this vision that you'll see, something that was written collectively, but Jesse did an amazing job putting all this together from a number of different sources. And so Jesse.
Thank you. So one thing we really highlight in this report is that one of the central myths about policing is that police were created to stop crime and keep us safe. And it's far too long to get into now, though it's all in the report, but really any realistic accounting of the history of police shows that they have always been about the control, the monitoring, and the suppression of Black and brown people and poor people of all races. Pittsburgh here plays a central role in the development of American policing as home to the first lodge of the Fraternal Order of Police, one of the organizations that has most stood in the way of making the necessary changes we need to implement public safety. But Pittsburgh is also home to the Freedom House Ambulance Service, arguably the first modern reimagining of public safety, and the idea that we could better serve our communities by bringing resources to the people who are affected rather than giving it to police. Today, patient transfer is something that would be insane to have police do, and that was because Freedom House took that duty away from the police, not only saving hundreds of lives, but investing back into the community. Not only servicing Black communities that police refuse to serve for patient transport, but actually hiring people from communities and building skills and development. As a recent report from the Abolitionist Law Center, our friends here put out, Black Pittsburghers are 44% of all traffic stops, 60% of all uses of force, 72% of all frisks, and 63% of all arrests, despite only being 23% of the city's population. Furthermore, a recent national study of 50 years of crime data found that only 11% of violent crime ends in arrests. In Pittsburgh, violent crime only accounts for 6% of all reports to police. So police in Pittsburgh, police in the world, aren't fighting crime. They're fighting Black and brown people. Last year, 12% of Black men in Pittsburgh were arrested. 12% of all Black men in Pittsburgh were arrested last year. So our vision is major cuts to policing throughout Pittsburgh and Allegheny County. We can easily take at least $50 million from Pittsburgh police, $100 million from police throughout the county. Pittsburgh is already over-policed. We currently have 31 officers for every 10,000 residents, which is almost double the number that comparable mid-sized cities have. We spend a third of the city's budget on public safety, but this has not made us safe. We need to reduce the police force. It can be easily done through retirements, through civilianization of rules, through maintaining the hiring freeze, and of course firing those who get repeat complaints, and instead invest that money in our community. We don't need to spend money on things that harm us. We need to spend money on things that help keep our community safe. What we need are decentralized community safety places. Places that are built and build upon the existing spaces and people who are already doing the work to keep our communities safe. We need to support them. We need decentralized services in every neighborhood that are developed in conversation with affected communities, operating on the principle that crisis response requires a range of responses, and that we need to address these issues before they reach the level of an emergency crisis. And that can only be done through addressing the affected communities and giving them the resources they need. So I'm going to turn it over to Jasiri, who's going to talk about our vision for how we respond to violence within our communities.
So I actually want to read directly from our report around violence and basically how we want to reimagine ways that we respond to people who experience violence, because oftentimes when you talk about policing, that's kind of the major thing. People are like, well, what are you going to do about community violence and how police respond to community violence? But one of the most powerful things about this process is how we chose to define violence. And the report says to truly address the impact of violence on our communities, it's essential to understand that violence is far more than just crime. Rather, violence is an experience that limits or diminishes people's capacity to survive. Unemployment, inadequate housing, lack of access to medical care, subpar public education systems, food insecurity, and racism are all violence. Violent crime within our community is often a response to these forms of structural and systematic violence. We will not solve it without addressing these larger forms of violence plaguing Black, brown, poor, and white people in Pittsburgh and Allegheny County. So Jesse also always talked about 6% of the police times on violent crime. When it comes to murders, it's 0.1% of police times is spent on this. You know, this report also talks about a report that happened in 5 years between 2010 and 2015, where Pittsburgh Police investigated 311 homicides. 97% of unsolved homicide cases involve Black victims. And so here we are. So what's going to change our communities? And it's interesting to watch police spend thousands of dollars on new technology. Imagine being a Black person in Homewood or East Hills, and you're watching the city spend thousands of dollars on violence prevention technology. When if those thousands of dollars were implemented in the infrastructure of your community to create a livable community, then you could have opportunities that could raise you out of the conditions that we have. It's not that we don't have the money. It's how will we prioritize spending the money? And oftentimes in our communities, the priority is policing our communities and not investing in our communities. But we all here know one common thing. The safest communities are not the communities with the most police. The safest communities are the communities with the most resources. So to give those resources to our communities is common sense thinking. And so this isn't, I know it seems radical, but it's really not. We have to just rethink what we mean about public safety and violence, because a city that's unlivable for Black people is a city that's violent towards Black people. And to make it livable for us is to invest in our community and not continue to pour money into a system that harasses us, brutalizes us, and discriminates against us every day.
Okay, thank you, Sir. We're going to hear now from Miracle Jones, the Director of Policy and Advocacy for One Hood, talking about how we reimagine the way we respond to people experiencing homelessness.
I'm a little short, y'all. I apologize. Like Justin said, my name is Miracle Jones. I'm the Director of Policy and Advocacy here at One Hood Media. I was on the committee to look at the ways that police respond to people experiencing homelessness. As someone who experienced homelessness in my childhood and my early adult life, this was something that's very important to me. And so I know a lot of you are supposed to get the link to the report. If you have not gotten the link to the report, please make sure you contact us so you can get it. But one when we're looking at the ways that people experience homelessness, are forced to engage with police, a lot of people do not know that when you are evicted, when you are kicked out of your home, the police are the ones who come, usually the sheriff, to evict you, right? So that's automatically the first encounter. If you are a student who is experiencing homelessness, sometimes it's the police officers that come to your school to do the wellness or welfare check on you. So that's another way people are experiencing policing when they're experiencing homelessness. Additionally, if you are actually at a shelter, some of the shelters in this region actually hire police officers to patrol and police the shelters. So even if you are someone who's trying to reestablish your life, you're trying to do the right thing, you're still forced to encounter police and policing. So when we looked at what are some of the ways that this community can actually need investment, the first thing we talked about is we need to change the conditions that lead to homelessness. Nationally, we are facing an eviction crisis, and nationally, Black families are twice as likely to face eviction. And so in the next few months, we know that there is going to be, unfortunately, hundreds and thousands of people across this nation experiencing homelessness and this type of violence. So the first thing we need to do is actually change the official definition of homelessness and understand that homelessness applies to people who are without safe, consistent, stable, long-term housing. Right now, our government actually defines homelessness, and that actually dictates when and where you can get funding and support services. So some definitions say you have to be experiencing homelessness for up to a year to get into homeless shelters and transition programs. Some places say you have to be experiencing consistently for over a month. We literally force people out onto the street in order to get support to not face homelessness. So we're forcing people to become homeless in order to have shelter and safety. We also need to look at the ways that people call cops when they see people who are homeless, whether people are panhandling, whether it's people in the parks, whether it's people outside on the streets. We have to understand that there are nowhere for people to go when they're experiencing homelessness during the day. Most of our shelters actually close, and so we force, again, people to come outside into these spaces because there's nowhere for them to go. There's nowhere for people to store their utilities. There's nowhere for people to store their belongings. There's nowhere for people to place their pets safely. We understand that there is a shelter opening in 2022, but right now in 2021, people are experiencing homelessness and need support and resources. We need to prevent police from targeting those in shelters. And I know we're going to talk about drug use later, but we also need to stop assuming that people who are homeless are also experiencing drug use and calling the police to search and harass people. We need to provide facilities for people 24/7. And we need to actually change the way we look at how we document people experiencing homelessness. In some of the shelters, if you are a third or first shift worker, you literally have to get your employer to write you a letter saying that you are employed in your schedule so you do not lose your spot in your shelter. So imagine having to tell your boss that you are homeless in order to keep your job so you can save enough money in order to have money to have housing. That is the reality of so many barriers that are facing people when they're experiencing homelessness and displacement within this region. We also need to adequately fund our frontline service workers and provide comprehensive training to prevent issues that escalate into police involvement. We need to end exclusionary requirements such as being unhoused for a specific amount of time or abstaining from alcohol and other intoxicants to be admitted to shelter or service centers. We need to make sure that people who are experiencing housing instability, if they choose not to live in shelters, have adequate safe places and ways to store their possessions and have access to basic hygiene and necessities. We need to end the practice of police responding to businesses, and we need to create public-private partnerships so businesses are not resorting to calling the police when they see people who are experiencing homelessness. It's very important that we look at the humanity of people who are experiencing displacement, who are unhoused, who are homeless, and understand these are our neighbors, our friends, our family members, and they deserve dignity and respect and not to be over-policed. going to talk about how people experiencing drug use encounter police.
Hi, I'm Alice Bell. I'm the Overdose Prevention Project Coordinator for Prevention Point Pittsburgh. Prevention Point has been providing harm reduction services in Pittsburgh for 26 years to people who actively use drugs. In 26 years, we have never had a problem at any of our service locations where the police seemed like the right ones to help. We haven't ever called the police because we know that for people who use drugs, any interaction with police can often lead to devastating consequences. The criminalization of drug use has always been to provide a legal reason for police to stop, search, harass, and arrest people who politicians perceive as a threat. Richard Nixon implemented the modern war on drugs as a pretext to target black people and people who are against the war, and criminalization of drugs continues to undermine our civil liberties. 689 people died of overdose death here last year. These deaths disproportionately affecting black communities at a rate of 3 times that of white communities. People don't call 911 fearing any interaction with police. Police should not be the ones to respond to the medical crisis of overdose. Arresting and imprisoning people who use drugs does not increase safety. It only harms that disproportionately affect black, brown, and poor people. Criminalization causes people to hide, to use alone, too often leading to death. If you want to reduce rather than increase harms related to drug use in our society, we must stop arresting and imprisoning people for drug use and treat this as a health issue, a public health issue, not a crime. Immediately end the practice of police responding to overdose calls. Unarmed, non-police, trained to deal with crises should respond instead. Decriminalize drug possession and drug paraphernalia. Fully pardon all those who have been convicted of nonviolent drug crimes. Prohibit future arrests of people for drug use. Prevent crisis and death starting on the front end by increasing resources directed to black communities, providing pre-crisis interventions for those who need assistance addressing problems related to their drug use. And implement a harm reduction approach, providing resources to target the actual harm people experience, as well as the underlying conditions, including poverty, racism, health, and mental health issues, traumas that are often at the root of problematic drug use.
We're now going to hear from Robert Lawrence of East End Therapists, discussing how we reimagine the ways we respond to people experiencing mental health issues.
Thanks, Justin. Sort of kind of tie in a lot of what everyone else has been talking about. I do want to highlight 4 things that are mentioned in the Diagnostic and Statistical Manual of Mental Disorders. For those that don't know, that's the big book that we utilize in therapy to come up with or to assess folks with their diagnosis. Thanks, Siri. So one of the first blurbs in there is mental disorders are defined in relation to culture, social and familial norms and values. Culture provides interpretive frameworks that shape the experience and expression of the symptoms, signs, and behaviors that are criteria for diagnosis. In addition, diagnostic assessment must therefore consider whether individuals experience symptoms and behaviors that differ from sociocultural norms and lead to difficulties in adopting in the culture of origin, and in specific social and family interactions. A lot of what we've talked about in our meetings have been decreasing the amount of police presence and response to mental health crises. It also starts with the overutilization of that word crises. For everyone, a crisis is different. A crisis could come from some of the things we talked about. Lack of access to resources. So putting forth those who are trained in this field to respond to those calls, having a police officer present is only going to escalate the situation, especially if we're talking about dealing with the black and brown community. In addition to having police respond to those mental health calls, they're really only going to respond with resources, and with that, it's taking to, these institutions that in this particular way, is not exactly going to encourage folks to go back, right? We're not working on building rapport with these services that are out there. So and such, by deferring to trained mental health professionals, it's a more appropriate way to deal with this situation, and we're also going to be able to connect various people to the care that they need.
We're going to now hear from Salim Holbrook, Executive Director of the Abolitionist Abolitionist Law Center. Excuse me, Salim.
I want to thank the Alliance for Police Accountability and One Hood for inviting us into this process of reimagining public safety in Pittsburgh. One of the first steps in liberating and oppressed people is liberating their imagination, and that is what this report has done. Pittsburgh is one of the most livable cities in this country, except for when it comes to black people. Pittsburgh is an apartheid city. Pittsburgh operates in apartheid policing. What we are expecting and what we are demanding is that the city respond to the demands of the community, because this document here is an example of participatory democracy. Oppressed peoples and oppressed communities created this vision. This vision is calling for an alternative to the traditional treatment of harm in our communities. Harm and trauma that is framed by generational poverty and oppression. Pittsburgh and cities across the United States has addressed this harm and trauma, with more harm from policing and prisons. The community now is asking for alternatives that they have developed to address this harm in their communities. This harm that impacts our families, because there's no wall between victims and offenders in our communities. However, there is a wall between police and the people in our community. There is a wall between government in our community. There is a wall between government and the people in our community. And what this report is calling for is for that wall to be abolished, that wall to be knocked down, and for the demands of Black Pittsburgh to be heard, but not only heard, but implemented. Because Black Pittsburgh for too long has been pushed on the perimeter of Pittsburgh. Black Pittsburgh is called out when Pittsburgh sports teams need support. However, when it comes to harm that is caused in the community by policing and by the city, the cries and the demands of Black Pittsburgh are ignored. And so this document is a demand to the city to hear the demands of the community and to answer and address them. So I want to thank Alliance for Police Accountability and One Hood, and more importantly, the community for producing this document, because this document is their voice, this document is their vision for what is going to make us all safer in our communities. So thank you, and we look forward to this vision being implemented. This is not a report that we intend to see collecting dust on the shelves of policymakers, because I can assure you this, regardless if the city is going to support this, regardless if the Pittsburgh community is going to support this, the activists and the movements up here are going to support it, and we're going to be in our communities supporting it, lifting it up, and implementing it. So thank you once again, Alliance for Police Accountability and One Hood, and the Pittsburgh community that produced this document. Now, let's get to work and bring this reimagining into reality.
Thank you, Salim. Thank you very much. As you heard here today, police are not keeping us safe, contrary to popular belief. We have a ton of data that supports this fact that is reflected in the report we have released today. Violence, homelessness, mental health, and drug abuse are public health crises and should be addressed as such. The goal is to reduce harm and not cause more harm. When someone is experiencing a mental health crisis, they should not be incarcerated. They should not be met with handcuffs and imprisoned. When someone is needing a home to stay in, that is not a reason to house them in prison. When someone is having issues with drug use and drug abuse, they don't need to be locked away. They need to be met with assistance, support, and help. And that is what this report is about. That is what our vision is about. That is how we see the world that we want to live in. And when you think about violence, people will say, what other way can you respond to violence but with violence? What other way can you respond to violence but with police? And what we're saying is we're focused on root causes. And the root cause of these issues is poverty. So the way you address this is to end poverty. And that is a part of our reimagining. I want to invite Desiree X up from One Hood as we highlight what our next steps are. And so as Salim stated, the goal is implementation. Many times visions come out, reports come out, and that is just the end of it. This group of people up here today are here because we're committed to making sure that our plan is implemented. We're committed to working with whoever we need to work with to ensure that Allegheny County is a safe place to live for all people, including Black and brown people. And so in our next phase, we will be partnering with the Abolitionist Law Center as a convener. We will be moving forward together to focus on implementation. We will be working with other coalitions. And I want to highlight that something I didn't hear a lot today is the connection that we had to national partners. And Jasiri brought it up, the connection that we had to national partners in this work. The people who are actually doing this right now in other cities worked with us on this. So we know it's real, we know it's possible, and it will be practical here. The powers to be will have you believe that this is the result of some radical activists, yes, who are not clear on how to move forward. They would have you believe that these are not people who are experts speaking to these issues. But I can't highlight enough how that is contrary to the truth. And I cannot wait for you all to read this report, come to your own conclusion, and then jump on our team to support making our county and our city the safest place possible for all of us. And now we would like to open up for questions, if you have any questions for any members of the coalition or ourselves. My mom always told me when somebody doesn't have questions after you speak, that means you were thorough. Thank you for coming. Somebody has a question. Yes.
Who are the people to whom you are taking this vision and making the demands? So who do you expect to work with to implement change? Who is the community going to?
So, of course, the people who are empowered to make these decisions are our county officials, our elected officials. We have been in talks with some people already about making this a practical thing in our city. We plan to continue to work with our incoming mayor to make sure that these are implemented in the city of Pittsburgh. And also other partners, the Department of Health and Services, Allegheny Health Department, and these are all people that we are already communicating with to ensure that this plan is implemented. And the biggest part of implementation is it being funded, right? So a lot of conversations are about funding, and that's one thing I don't think we highlight enough is about the budget cuts that need to happen to make this work possible. And then just there, you want to just highlight where they can find the report?
So if you wanted to look at the report now or get a copy of the report now, you can go to www.onehood.org. That's the number one, hood.org/public safety. So if you go to onehood.org/public safety, you can access the report right now. If you want to read the report, we also want to thank Motormouth Media for also doing a lot of work helping us put together the report. We also want to thank Ime Alaquiva and Your Mom's House for providing the pictures in the report, free of charge. I mean, this is what this brother does for a living, and he's very good at it. However, he took these pictures because of what the community uprisings were doing, and he gracefully donated those pictures to us for our report as well. So thank you. Am I missing anybody else, Brandon?
And also you can find the report on www.apa-pgh.org. And I think we are done. I also would like to thank all of our coalition partners again and all of our community partners for coming out to support us. Thank you all. Give yourselves a round of applause. These are diverse individuals representing many different organizations who support this call for reimagining public safety. Thank you again.